Hi there, my name is Ashley and I work on the communications team at Children's Wisconsin. Each week, we're taking time with some of our providers to talk about the ways that Children's continues to support and provide the best care for kids. Like everyone, we've had to adapt and change as we respond to COVID-19. Joining me today via Zoom is Dr. Jenny Walczak, Clinical Director of Mental and Behavioral Health and a psychologist at Children's Wisconsin. Jenny has offered to provide resources and answer questions about mental and behavioral health, especially during COVID-19. If you have any questions on this topic, please leave them in the comments. Thanks for taking time to chat with us today, Jenny.
No problem.
To start, can you tell us a bit about what you and your team do at Children's Wisconsin?
Absolutely. Thank you for having me. So Children's Wisconsin offers a variety of mental and behavioral health services, and that includes counseling, therapy, medication management, neuropsychological testing, and school-based mental health services. We have a large staff that includes psychiatrists, psychologists, neuropsychologists, and master's level therapists. Our team is able to treat a wide variety of concerns, and that includes, just to name a few, anxiety, behavioral disorders, mood disorders like depression, trauma, PTSD, and gender identity issues. And these services are offered at a number of our locations around the state.
Okay. For kids, how can COVID-19 be impacting their mental and behavioral health?
Yeah, so with schools and daycares closing, many children's daily lives have been significantly disrupted. Many children are now socially isolated from family and friends. And for some, food insecurity has become an issue due to the schools closing. Parental stress, dealing with family members or friends that are sick, potentially family or friends that have died, and the financial impacts of COVID-19 can be felt by children. And it's really no wonder that experts are saying that COVID-19 is having a significant impact on children's mental health and will really continue for quite some time, even after this state of emergency has ended. A recent study I read showed that children confined to their homes during COVID-19 were experiencing higher than normal symptoms of anxiety and depression. So it's just really important for us to keep in mind that COVID-19 is definitely impacting kids. Children at any age can experience anxiety. Just in case you didn't know, some signs of anxiety in children can include restlessness, trouble focusing or concentrating, headaches, stomach aches, tantrums, crying, difficulty sleeping, and increased clinginess. So they're just by your side and they don't want to leave you. For kiddos who may be experiencing depression, some of the signs that you want to look for are they just seem sad all the time, irritable. They don't play with their toys anymore. They stop engaging in activities that they really once enjoyed. They may seem withdrawn more than usual. Have changes in their eating habits, so they're eating too much or they're not really eating anymore, and have sleep disturbances. So those are all things that really could be impacting kids right now and to look for.
Okay. And how can parents check on their kids' mental and behavioral health while they're at home?
Yeah, so studies have shown that having just one stable, nurturing, and caring adult in a child's life can really be protective when there's a trauma or something really difficult that kids are going through. Children thrive and do well when they feel safe and they're having their basic needs met. With that being said, having frequent conversations with your children about how they're feeling in a developmentally appropriate way, and we're going to talk more about what that means, is really important. And I think some people feel, well, my child's young, I don't need to talk to them. They don't know what's going on. But like I said earlier, there's a lot of parental stress and just a lot of stress in the home right now. And it really is important to have these conversations. So when you choose to engage your child in a conversation, open-ended questions like, asking them what was the best part of your day, what was the hardest part of your day, are great conversation starters, just to kind of open up a conversation with your child. If your kiddo is having some negative feelings, validate those feelings. So that means acknowledge that they're going through those things and really express how proud of them you are for sharing that with you. Instead of offering to fix the problem, so tell them what to do and how to do it, try to problem solve with them. See, kids are really resourceful. See if they can come up with some solutions and help them take ownership of that problem. Reminding your child that you're there for them reinforces that they're safe. And at minimum, if you do that, that's going to go a long way.
Okay. Now, during normal times, a common concern for parents is screen time. That's become even more pronounced during the isolation. What guidelines would you suggest for screen time in kids?
Yeah, so I've gotten this question a lot lately, and I think this is a really big question weighing on a lot of parents' minds. My key message I'm going to give you is trying to find some balance. And that balance may look different for different age groups, for different kids. It's going to be what balance works for your family. So by balance, I mean balancing screen time with other healthy activities. I think before we even dive into more of the nuts and bolts on tips for screen time, I think the number one thing to really be remembering right now is safety. And so kids are on screens more than they have been historically. And so making sure that you're checking who your child is talking to online, who they're talking to when they're gaming, what pages they're viewing is more important than ever right now. The other piece too that I really want to point out is we want to try to limit kids' exposure to how much information they're getting online and the news about COVID-19, because we all know that we just get inundated with that information, and that can be really anxiety provoking for kids, especially when they don't know how to make sense of that information. So two big tips there, kind of safety, making sure that you're checking what your child is looking at, and then really reducing all of that inundation of information about COVID-19. Some more tips about managing screen time include trying to watch a video that includes some physical activity. And you could even do that together as a family. There's a lot of resources if you just plug into your search engine, your child's age and a physical activity, a video will come up that you guys could do together. And then focusing on screen quality. And so having your child watch things that are more educational is probably going to be preferential to something that may be more violent. I read an article recently that encouraged looking for programming that's interactive, educational, and age appropriate. So those are going to be quality videos for you to watch. The last tip I have for screen time is really trying to find a routine for your family and then setting limits around screen time within that routine. If you have a structured routine, it may be easier to say, okay, during this block of time, we're going to do screen time, and then afterwards, here's the activity. Just want to validate for parents that this is a really hard time right now, and give yourself some grace and give yourself some leeway in trying to navigate this, because it's not easy. So don't beat yourself up about it.
How would you recommend parents talk to their kids about what's going on, and how would that conversation differ between a young child, a tween, or a teen?
Yeah, so before talking to your kid, you're gonna really want to check in with yourself and make sure that you're calm and be aware of your own feelings. If you're feeling anxious or keyed up, take some time to calm down before having that conversation, because kids are going to pick up on that anxiety through what you say and do. So really checking in with yourself, making sure you're in a good space before you have that conversation. You're going to then want to give your kid the time and space to share their feelings. Again, like we talked about, validating and acknowledging your child's feelings and reassuring them that they're safe. Those are the critical pieces here. Let your child know that there's grown-ups who are really working hard to deal with COVID-19 can also be reassuring. A good place to start with a conversation about COVID is to first ask your child what they have heard. And that's going to differ for teenagers and toddlers. So for a toddler, you may ask, like, have you heard anything about people getting sick? And you can then craft your conversation from there. For a teenager, you can be more head-on and direct and say, have you heard about COVID-19 or coronavirus? That's going to be a good way to open up that dialogue. During that conversation, listen for misconceptions. Like we said, kids are hearing parental conversations. They're seeing things on social media. They're hearing mom and dad watching the news. And so it's important to ask them what they know and then listen for those misconceptions to clarify them. Try your best to answer honestly. And if you don't know, that's okay. Sometimes you're not going to. I think many adults don't have all the answers right now, and we're just doing our best to figure it out. So it's okay to say that you don't know, but you're going to do your best to try to find out.
Okay, great. And actually, Jenny has a blog post at chw.org/newshub about how to talk to kids about COVID-19. It goes into the details that she just mentioned. Jenny, what should a parent do if they have any questions?
So you can, if you have questions or want to seek mental health treatment, you can call our centralized mental health intake line. And the phone number for that is 414-266-3339. If you just want more information, you can visit chw.org and just type mental health into the search engine. And that will bring up all of the information about our mental and behavioral health department at Children's.
Okay, great. What can kids or even parents do to help alleviate some of the stress or anxiety they may be feeling now?
So I brought this up once already, but I'm going to say it again because I think it's that important. And that's to try to establish your new normal routine. Your routine is likely not going to look like what it did pre-COVID. And so establish what your new normal is. For parents entering summer without summer programming that they had planned on, you may need to now adjust that routine and that schedule again. Because your summer plans have changed or your kids' summer plans have been canceled. So that's going to be an evolving process. Take control over what you can is also a helpful tip for parents and for children. So when kids and adults feel stress, it's not uncommon to feel helpless. Taking action can help kids and parents feel empowered and safe. So talk to kids about things that they can do during COVID. And that's things such as getting enough sleep, making healthy choices around food, getting physical activity, washing their hands for 20 seconds before they eat, after using the bathroom and blowing their nose. Although this is a stressful
It looks like Jenny might have frozen. Let's give her a second. Oh, she just caught up. Jenny, could you repeat that last part that you just said, please?
Yeah, so I was saying about talking to kids about what they can do to stay healthy, like getting enough sleep, making healthy choices around food, getting physical activity, washing their hands for 20 seconds before and after they eat, after using the bathroom, and for after blowing their nose. Although this is a stressful time for everyone, I've been trying to find some silver lining. And so I think that this time is a good time to connect or reconnect with your child and with your family. People are being really creative in the ways that they're spending time together in quarantine, doing crafts, taking virtual field trips, video phone calls with family and friends, and making future plans that you can look forward to are great ways to pass the time and help parents and kids feel connected. Another thing I think a lot of families have heard about is mindfulness or meditation. Mindfulness activities focus on taking a calm moment to breathe and really focus on being present in the here and now. Mindful activities can be more passive, like deep breathing, but they can also be more physical, like going out and taking a mindful nature walk where you and your child are really paying attention to the world around you. These activities can help to relieve stress and anxiety that parents and children may be experiencing.
Okay, great. I know you primarily work with kids, but do you have any advice for all the parents out there who are maybe stressed out at the moment, juggling work from home with supervising and teaching their children all day?
Yes, so as a parent working with 2 toddlers at home, I completely understand this challenge. There's a lot to juggle right now, and parents have a lot on their plate. Um, I think for parents, it's really important to try to find time for your own self-care. And this may be taking time to engage in a favorite hobby or connect with friends. I recognize that even that may be hard for parents to carve out time for that right now. So don't forget that self-care also includes doing the basics for yourself, eating well, exercising, taking a hot shower, getting enough sleep. Those are ways that you can take care of yourself so that you can then be available and able to care for your children. I think parents also can spend some time checking in on how they're feeling. It's okay to feel anxious right now. I think a lot of people are. And so that's a really normal feeling to be having. Similar to the recommendation I made earlier with kiddos, I think it's also important to take control over what you can right now. That can help you feel empowered. So for those parents working at home, a tip would be maybe trying to find some physical space that is your own for your work. And so keeping that space consistent, having all of your work materials there can help you feel like you have a little bit of ownership and control in a household that feels kind of messy and chaotic. And I'm speaking from personal experience here. As mentioned earlier, also, I think a lot of the pieces I talked about with screen time can apply to parents as well. That constant inundation of material on the news and on social media about COVID-19 is anxiety provoking for adults as well. So set some limits around your own screen time and take a break, put the phone down, turn off the TV, and that should help.
Those are great tips. We're also trying to post mindful moment videos on our social channels every Wednesday that could be helpful, so watch out for those. Jenny, what signs should a parent look for that would indicate that they might need to contact an expert for help?
Yeah, so again, want to reinforce it's really normal to feel increased anxiety and even more down right now than usual. This is an unprecedented event, and the unknown can be really difficult to cope with. With that being said, if your child's experiencing persistent, so they're ongoing changes in their behavior or mood, they seem to be unable to complete everyday tasks that they were once able to complete, or they're having a lot of changes in their sleeping or eating habits that are affecting their functioning, then you should consider contacting a mental health professional for more support. I think it's okay to need help and ask for help at any time, even if you're unsure if your child needs treatment. So giving us a call, talking through your concerns, and then we can help guide you further. The caveat to that is if your child's demonstrating safety concerns, so they've been talking about hurting themselves or wanting to hurt other people, or they've engaged in any kind of self-harm, that is a very serious concern. And you're definitely going to want to call 911 or take your child to the nearest emergency room.
Okay. Now, you're at home currently. Can you talk about the types of care your team can provide from home during COVID-19?
Yes, I am at home, and our mental and behavioral health team is also currently working from home, but we are gearing up to re-enter the office over the course of this month and into June. Therapy and medication management appointments are currently available via video through our private parent portal, which is called MyChart. Or if parents are unable to access video visits, then we can also work with you to figure out how we can help you via phone. So we have a slow transition back into the office and are looking forward to working with your child now, either via video or once we return to the office.
Okay, great. What other services are your team providing currently?
So once families are able to come to Children's Wisconsin for their visit with a mental health provider, we want to just talk about there are going to be some changes to our environment to ensure your safety and the safety of our staff. So like I said, we're continuing video visits for now, and then we'll transition back into the office as we approach June 1st. When you and your child come to the office, you'll be screened for COVID-19 symptoms. And not only at the office, but also we'll be calling you before the visit to screen you for those symptoms to make sure that you're able to come in. We ask that you and your child come for the appointment. We're really trying to limit the flow of having too many people in the office that we don't necessarily need to be present. All patients are being encouraged to bring their own mask to wear while in the office. And if you don't have a mask for you or your child, we will provide you one when you arrive, so that we don't want to put up barriers to treatment. Providers will also be masked, so everyone's going to wear their mask while they're on the office premises. And so things may look different when you arrive, but we want you to know that our goal is to keep you and our staff healthy and safe while providing you care. So I think some of the changes that you're going to see once you return to the office or come to the office for the first time.
Okay. During COVID-19, what is concerning you and your team?
So we know that this is a stressful time for everyone. And as you may have heard in the media, we're really on the verge of a mental health crisis due to COVID-19. And I think that's really a crisis for children and adults. I think one of the big takeaway messages from today is that COVID-19 is impacting the mental health of children. And it's important to tune into your child even more during this time to make sure they're okay. And we're talking about from toddler up through teen and beyond. So it's really all children. If you feel like your child needs more help, don't delay to reach out for more information. Reaching out now for support can also help to decrease symptoms, to decrease an escalation of symptoms if you chose to wait. So act now before things potentially get worse. I also want to just add that there's a lot of attention on mental health right now, but the mental health needs of our kids as a community were not being met before COVID-19. Which is why last year, Children's committed $150 million to improve access to our services. So we're committed to meeting urgent and emergent needs, and we're increasing services and appointments, but they're still often wait lists. So we're really trying to address not only the ongoing mental health needs of kiddos, but also trying to help with during this state of emergency and this crisis with COVID.
Sure. Is there anything else you would want families to know about Children's Wisconsin?
Yeah, I just want to reiterate that Children's Wisconsin is committed to providing mental health care for children, and we're here to help care for your child from home or in person. We're also taking steps to ensure that it's safe for you and your child to come to the office if needed. So we're really committed to you and your child.
Okay. We do have some questions from people online, so we'll take those now.
One of the questions is in reference to some people are seeing a little more the normal defiance or resistance in their kids, in the 7 to 10-year-old range. Is this something normal that you would expect given the environment? And do you have any perspective on how a parent can help cope with this and help the child cope with this?
Yeah, so I'm going to speak very kind of broadly. Yes, I do think this is a really normal behavior right now. Like we talked about, this could be potentially a symptom of some anxiety. So kids are feeling anxious. They don't know what to do with that anxiety. And then we see increased defiance, acting out, tantrums, kind of whatever you want to call that behavior. I think the really important thing is to check in with your kids first, see if you can have a conversation with them about how they're feeling, ask what they know about COVID, and then a kind of a more therapeutic recommendation I would make is to really take a look at what's the structure of your home is. Does your kiddo need more structure? Do they need you to help them structure their day so that they are feeling less anxious, so that there are less opportunities for acting out and more opportunities for making good choices? I think really kind of look at so how your child is feeling and then what's going on in the home environment that maybe you could change or structure differently. Another thing too to just consider, and this could be for all parents or parents who are having kids with increased behaviors right now, try to spend some extra time with your kids. I know that sounds crazy because we're with our kids all the time, but maybe taking 20, 30 minutes to really sit down and do an enjoyable activity with your kid where you're giving them one-on-one attention, you have their attention, and really to connect and have a positive moment.
Oh, okay, I think Jenny froze again. We'll give her a second here. If you do have additional questions that we haven't answered throughout this, we will be answering questions as much as we can in the comments. Hey, Jenny, are you there? Can you hear us?
I am. I'm sorry. Did I cut off?
No problem. Yeah, it just froze for a second there, just I think with the last couple seconds of what you were saying.
Yeah, so I think just once the light at the end of the tunnel is hopefully once we can get out of quarantine and spend some more time outside, that may also help with returning your child's behaviors back to normal. Apologize for the technical difficulties.
It's okay. We're doing what we can, right?
Right.
Working from home. Anything else?
Last question here is, while a lot of what you talked about, I think, applies to both younger and older kids, is there anything specific in terms of general advice you can give for parents of teenagers who might have more pointed and direct questions or considerations and possibly a higher understanding of what's going on in the state of the world with COVID?
So I think that's a great question. And the best advice is to answer openly and honestly. If you have a teen who is asking you questions that are at a higher level and they want to know that information, I think it's okay to provide that information. Also remember, they're a child, and so you want to also provide that reassurance to them, making sure that they feel safe. So I think it's okay to have that frank, open, honest discussion with them, letting them know that you don't know all the answers, and then providing that reassurance to them.
Okay, great. Anything else? No? All right, thank you again, Jenny. If you're in need of mental and behavioral health resources, please visit chw.org/mental health. That page has more information about our mental and behavioral health commitment, as well as a link with more information about how to access care at the bottom of the page. If you have any questions about Children's Wisconsin or COVID-19, please visit chw.org/coronavirus. There you can find all kinds of resources, from details about children's locations and when they're open to blogs like the one Jenny has on how to talk to your kids about COVID-19. At Children's, we're adjusting to COVID-19 and are taking steps to keep our patients and staff healthy. And of course, our teams are continuing to provide the best care. We'll be here to help you care for your child, and that will never change. So please do not hesitate to call your doctor's office, your child's doctor's office, use MyChart messaging, or use our online urgent care. Thanks for watching, and keep an eye out for our next conversation with a member of the Children's Wisconsin team coming later this week. Thank you.